Good morning, Avinians. Wow, it feels so good to say that to you. And I can actually share my smile when I say it this time. Mondays are usually my Rev Call testimonials where we can all be in our jammies, but today is a bit different. Welcome to our Saturday morning Call of a Leader webinar, and I'm honored to be sitting in for our much beloved host, Dave and Valerie Johnson, who are making their live appearance, returning back to Idaho Falls, Idaho today. Just a little plug for their trip. They're actually at the Idaho Innovation Center on North Yellowstone Highway at 10 to 12. So don't miss it if you are in their area. I know Kathleen Davies and Susan Mayosi are excited to have them there today. So today you are getting it from my heart. And I do want to hit a few points. The biggest thing is that I am sharing from my heart what an honor it is to be here and to be in this Zoom with you at such a time as this, to be here breathing, to take breaths without choking, without coughing, to assemble words without stammering, and to be grateful for this life, that we know the power of Avini Health. And I want to share that with all of course, our Avini family, but all the new people that are here and listening possibly for the first time and taking a look. And we have so much to share, so much love to pour into you. We hope that this sounds genuine, that we express to you how powerful these products really are. And if you stay with us long enough, like myself, you find out that we can teach and train old horses new tricks. And we are careful not to make any claims about our products since they don't cure anything. They're simply removing the heavy metals out of our bodies and the toxins and poisons that we're constantly being bombarded. We are getting rid of those through these amazing products. And so to prove that our body has the ability to do that, just watch what happens when you cut yourself. Doesn't our body know how to take care of itself? It does. It heals. If there's nothing, can't throw dirt on it, that'll interrupt it, right? Heavy metals and toxins interrupt the natural process of our body. So how does it know to do that? Well, we're going to find out as we go forward here. And I want to thank my wonderful host here, Nikki Walton. As you probably heard, if you were earlier on before this recording, helping me. It's technically challenged, but just bear with me today. I want to share a couple of, again, heartfelt pieces as Dave does. Dave Johnson is so good about sharing experience, and I certainly have nowhere near his capacity for bringing forward all of his vast experience, but I cheat. I watch Netflix. And there was a gentleman on that he is one of the top realtors in Manhattan. And he shared that, when he was just a little boy, he was 10, and his grandfather took him for a ride past a cemetery and said, there, Brian, are some of the greatest athletes, mathematicians, artists ever known, and more. And the sad part about that is there is all untapped potential that never got to manifest. And while that seemingly seems like a dark topic, what that does is inspire me to help relay that we're alive, we're breathing right now, and we've got to seize this moment to bring forward everything that's in your heart. Don't sit on it. Don't wait. Share what you know. Share this incredible gift with somebody who doesn't know, just like 2 years ago, I didn't know. And wow, look what happens. Whole new worlds come about, right? So, yes, thank you so much. We do. We've got this. We really do. We've got this. And to start, so want to do just a little bit of announcements for those of us who are actually in the program of Avini Health. While Neil and his lovely wife Claire are enjoying a cruise in Europe right now, just think about it. He deserves it. Works so hard. In the meantime, he thinks of us and he gives us a very special promotion for this weekend. He's allowing us to have both our Avini Hydration Plus, whoops, wrong one, Avini Hydration Plus packets, travel packets. And I think it was inspired because he's traveling, right? Aren't these clever? And our Avini Plus Fiber travel packs. Okay. He's putting this on special this weekend through Sunday at midnight. Normally, the combination of these two, which there are 30 hydration packets plus 60 fibers. So that's a single serving every single day for a month. Normally, this would be at our cost, wholesale, a very good value at $125. This is currently $99 wholesale for us. And the reason I'm excited about sharing this incredible value, this sale, is Neil does this right on the tails of our, and by the way, Neil Roth is our CEO, again, for you newbies. Jumping. Sorry, so excited. Got to tell you. So our wonderful CEO is so generous to us that on the heels of our already successful first through 11 auto delivery, auto ship program, where we receive an extra additional 20% in free bonus product, which here, this is July 2024, typically one of the lowest business months ever. And we're seeing record numbers again. Okay, we're seeing the most explosive numbers. And on the heels of that auto program, he throws us another incredible opportunity to buy this at a discount. We didn't have these before. And so just recently, I took these out to dinner. How wonderful to have these right there when you're having your dinner. Makes for great conversation. Sample them to your dinner guests, your lunch guests. Just such a wonderful thing. I mean, we need our hydration, right? We need our fiber. So again, just wanted to point this out. Don't miss this. And see, I want the business people and the Avini participants to take advantage of this and actually help hit your what you destined to hit for your goals by the end of the month now. Right now, use this now. It can make the difference whether this July is a happy ending July for you or missed it by just that much. Maybe it was this sale. Maybe it was this sale. All right. We're having fun here. Let me hold on to my love stone here and let's move on. So I feel, again, so blessed because we get to share. And how many of us have reached out to folks who didn't hear the message the first time? And I'm honored that we get second chances. We can reach out again. So let's go ahead and share this great Avini message. And I'm going to share a screen, do a small presentation. And you saw, all right. I'm using the slides that Doug Dickey put in our spreadsheet. Thank you. Thank you, Rich Cotter, for avinihealthtraining.com. And these slides, I'm actually starting on slide number 21 because I think it's pretty important to start out with what's the point. We're dealing with a really toxic world. It's becoming more and more evident. And I think it's getting easier and easier to bring up this point that heavy metals and poisons are really taking a toll on all of us. And I love this slide because it says exactly what we're talking about. And don't underestimate this. Think about the people that you know that are just tired. They're just sluggish. They don't know why they feel like they do. They hurt. I hurt. I used to hurt. I mean, oh my goodness, my story is another time, but you just don't feel yourself. And maybe it's even more extreme. Maybe the doctor has said, you get that dangerous little notification that it's a little bit more than just achy tiredness. And so we don't want to take that for granted. And so thank goodness we have an answer here. All right. And how am I going to get back to that original slide? I'm going to have to Thank you guys. Thank you for being so loving with me to get to the beginning. All right, just going briefly over our presentation, and that it's basically going to cover that it is a worldwide problem. And here in our country, it's especially prolific, and how it affects us. Um, we're going to cover the biochemist who's created the answer to our problem. And I'm so honored. We're all honored to know Rick Deitch. It's wonderful to know that he has taken something from nature and made it so perfect, so pristine, that it is going to do what it's going to do. And the beautiful part is, it doesn't care who we are, it's going to do its job. And we're going to get to that and why this might be the only option to help get these things out of our body. All right. So the obvious is that most of us, in fact, most all of us, did a presentation the other day, raised hands. Everybody in the room said, we knew what we knew to do, which was eat healthy, take supplements, exercise daily. And we believe that would be the answer for staying healthy. When in fact, how many of us have done all of these things and still felt lousy, right? So it's a little bit more than that. And even as much as drinking clean water, breathing clean air, and getting plenty of rest, we're doing the best we can. Do we know that our water is perfectly clean? Are we absolutely sure? Are we getting it in plastic bottles, right, with the wrong number on the bottom? Is our air less than clean? And are we really, really getting the rest we need? So again, we've got to correct all of these things. And even doing all 6 things that we've just gone over, why are people still getting sick? And if we do get sick, it's really a scary world out there. Our health options are very, very limited. It's scary to think that over 16% of our gross national product has to do with healthcare costs. And when we go to the doctor and they offer us a prescription, they're never really intending for us to eventually come off of it. Or perhaps the purpose of that medication isn't, it doesn't have an end date. So that's kind of frightening. You would think we would take the medication, get better, and that would be the end of it. Sadly, no. Sadly, no. That's not usually what is intended when they offer medication. And insurance, well, I can tell you from personal experience that insurance is available for fewer and fewer people. A lot of people are having jobs that don't offer insurance. Maybe people are working just to get that paycheck, and benefits aren't offered. I know that was the case for a few of my jobs in the past. And I even became a health insurance agent while I lived in California to create my own healthcare package, only to have it taken away because there was a change in governmental rules. So sad to say. And then finally, over 30% of our people are on Medicare, which again has limited access to the higher ended healthcare options. So, not really perhaps our favorite option, right? And so, well, people say, am I really toxic? And we've seen this sign. If you've been with us, we see this picture quite often. And every time we breathe, every time we eat, every time we touch something, we're receiving toxicity at some level, and we just really can't avoid it. All right. So just considering these points, that no matter how clean we eat, no matter how much we try, the usual methods of cleaning our bodies, just whether it's urination, going to the bathroom, exhaling, breathing, maybe it's a foot soak, maybe it's a detox bath with borax, whatever these are, after a while, these become overloaded. I love, love, love the description of being offered pizza to eat every single day, 3 meals a day. And somebody is going to deliver a pizza box of your favorite cheese, mushrooms, and pepperoni was always my favorite in years past. And imagine every meal you've got to eat that pizza and then store the box somewhere in your home. Can't throw it out. Can't throw it out. And perhaps for the first week, you've got a kind of a stack of pizza boxes in the corner of your kitchen. But over a year, over 10 years, over 30 years, over 50 years, Where is there going to be room in your home to move around safely and in cleanliness? Sadly, there's not going to be a way. And our bodies are like that. It's like we're filled with toxins that we really accumulated those toxins, and we need a real good way to be able to eliminate those safely. And can our bodies really fix themselves once they have those toxins removed? Well, we're going to say that yes, they can, right? And let's take a look at this. I love this circle. And normally you would think that we would look at the chain of dangerous sources from the top, but I actually prefer to start over at the bottom with household chemicals, petroleum manufacturing. You know, we are so much a culture of technology, and it has been because of our technology that we've adapted all of these conveniences with our cell phone, which thank goodness I don't have it here. But I was going to say our technologies that create the need for mining the substances that make them work. All right. Mining in general just releases things that we don't want. Our water tables end up being damaged, right? Manufacturing plants. Everybody remember The Graduate in the late 60s with Dustin Hoffman. What was the famous scene that he was given the advice for? Does everybody remember what he was told? That would be the upcoming wave of the future for income. Plastics, right? Plastics. And the manufacturing of plastic bags, plastic everything. Tupperware. All right. And oops, I probably should, we're going to have to erase that word, but okay, plastic containers and our bottled water cleaned with chemicals, and those bottles cleaned with chemicals, and then they put water in it. We're consuming that. All right. So there are over 70,000 known chemicals that get into our food, our air, and our water supply. So I just love this slide. It's very identifiable. And I'm going to move forward. And it's as if heavy metals and plastics weren't enough. Let's think of the PFAS, forever chemicals. My goodness, this one hit me hard when realizing that how many of us had parents and actually had the pans ourselves. Teflon, right? That wonderful slippery substance, Teflon. There is not a human on the planet that does not have this item in their blood. And that's a scary thought. How did Teflon, which came from the eastern side of the United States, how did it end up in Archipelago and in Malaysia? How did those people end up with Teflon in their blood? Well, we're one planet, everything circulates around, the water flows. Factories dump into water streams that go into oceans that just get everywhere. So the other one that was frightening is I love to floss my teeth and I love those double strands. Well, gosh darn it, they're coated in Teflon too. All right. The pizza boxes we were talking about, not just were we enjoying those wonderful pizzas, the slippery surface, that coating, forever chemical. The clothing that our children wear up to age 5, it's law, it's by law. They must be fire retardant. And that those chemicals get into our children's bodies at a very early age. So yes, it's all posing a bigger risk. The volatile organic compounds, right? The benzene, that is a topic that deserves its own show. The changing of sex organs for frogs in water due to benzene in water and these compounds, just terrifying. And then, of course, our microplastics in our water and so on. All right. And of course, in the news, we'll just brush by this really quickly. 100% of our fast food services, hey, even my favorite Del Taco. Oh, again, shame on me naming them, but how many of us have our favorite place that we think we're going for something healthy, just a vegetarian burrito? 100% of our fast food places were testing positive for heavy metals, lead, and cadmium. And then I love, Doug Dickey does a fabulous presentation on the use and the dangers of arsenic. Incredible findings in nutritionfacts.org on how much arsenic is too much. If you do nothing else, think about this one. Arsenic being used where? In chicken feed. And why would we need arsenic in chicken feed? Well, to keep it from molding, right? Just to keep it from molding. But somewhere somebody forgot the steps of what is that chicken being used for? Or that chicken actually, it's coming to us. I can't think of what what step they missed in recognizing that they're feeding chickens arsenic. We're eating the chickens. So subsequently, we are getting that as well, and so on and so forth. Here's another item that touches me personally because I was part of the Great Green Movement in the late 90s, early 2000s to help bring in and recycle tires for artificial turf and artificial. Anybody seen those flexible interlocking gym mats that children play on playgrounds? Those are extremely dangerous. If you see the little children, how coughing may come up, their sinuses are constantly challenged with breathing issues, their lungs. So, artificial turf, the use of petroleum based tires, and with all good intent, again, trying to recycle these into usable products. Sadly, these are foreign for us. And then, of course, the pollution found in newborn babes through the 2005 landmark fetal cord blood study showing over 280 toxic chemicals in mom's umbilical cord to baby. So we're starting off at a deficit. And so, all right. Well, this slide is saying, will we ever really be able to get rid of everything that the world is doing to us? We may not be able to stop the world from doing what it's doing and in its process, but we do have a solution to help take care of each and every human, one human at a time. And I'm so excited. And here we are. This is exciting. Here is our amazing biochemist. He is the formulator and creator. He opened the entire world arena of the worlds of zeolites and in the form of Cell Defender. He is the category creator of the zeolite categories, creating Cell Defender. It has sold over 8 million bottles since its inception. And it is the only liquid zeolite on the market that is clean and can make the claims of doing what it is doing through his creating a 34-step, 3-day process of cleaning it and making it maximally effective to take out heavy metals and toxins from our body by simply shaking it. Here's our item right here. Shaking it, taking 5 drops. It was just that simple, and allowing it to get inside our body. What is amazing to me is how valuable this little bottle is at such a low price. So it's worth gold to me. I love gold, but I love my Cell Defender. All right. So we're so grateful for Rick Deitch, our Chief Science Officer, for bringing this incredible item. And then even more grateful that we have since May of 2022, the inception of Avini Health. This mission was brought about because so many people who had used this product that had been available in the past but unsuccessfully carried forward, we needed it. We absolutely needed it. And so it was implored to take this to Rick and really start our own company and create a mission of getting these products in people's hands on a timely basis and just with no obligation through Avini Health, through our CEO, again, much beloved Neil Roth. Genius. I call him a super genius. Many people call him an angel for creating our structure of our company. And of course, the working efforts of also genius Doug Dickey, who benefited, his life depended on this little bottle and could not go without it. And so between the three of them, creating a unity, and a host of other people, including the people on this call who have followed this bottle for years and years, praying that this company would be our own, that it would be in the hands of integral people like these gentlemen and you and me, so we can deliver it to the public and make it available. So learn more about them. Okay. And right now I'm going to switch over, and we have this logo of Robin Wend, our Chief Science Officer. So this is Diamond, Robin West, opening for Rick, explaining, allowing him to explain with her passion. Don't you just love her? Just bringing forward her passion and introducing Rick.
Avini Cell Defender and Bad Cells.
I love Cell Defender, as you said, is the tip of the spear of Avini Health. And I want Rick to start with that because it's your zeolite product, your Cell Defender product that has captured our hearts because, you know, Marcy saving her life. There's so many people now that we're just having, as Chip says, that stream of miracles. I have a lot of people who are having, you know, issues with bad cells. We all do. We're running into people that are just having toxic load and mutated cells and all that kind of thing. How does the science work on that? I had a question today. How does just taking out the heavy metals help me? Well, there's also another part of that you and I talked about, apoptosis. And would you talk a little bit about that? And I just said it wrong again, didn't I?
First and foremost, we want to talk about toxins. You know, anyone says, am I toxic? As long as you're eating, drinking, and breathing, you're exposing yourself to toxins on a daily basis. And it is true that our bodies have lots of mechanisms to detoxify. We have all sorts of transformation mechanisms between our liver and our kidneys. We have our skin protecting us. We have our digestive tract protecting us. We sweat, we urinate, we go to the bathroom, we get these toxins out. But the fact is, our exposure is higher than our ability to excrete. That is an absolute fact. We can excrete toxins faster than we're exposed to them. And what happens is those toxins build up in our bodies. We grow a body burden of toxins through toxic exposure. And it's even worse than just our own exposure, because there's studies published that show that we're born with these toxins. Going back over 20 years, the Environmental Working Group did a study looking at umbilical cord blood of newborns and found over 200 toxic compounds in the umbilical cord blood, over 70 of which were potentially carcinogenic or cancer causing. So we're born with this body burden of toxins. So we have to actively detoxify. And the problem is that so many people, when they think of the word detox, they think it means going to the bathroom. Because for many, many years, detox products were either diuretics or laxatives. And then even sweating, if you could sweat, things would get out of your body, toxins would get out. And that is true. If things get out of the body, toxins go along with them, but it's not specific. And as far as I can tell, zeolites are the first ever specific systemic detoxifying agent ever. And our particular zeolite, because of the activation and micronization process, is the only one on the planet that actually gets into the body, gets all through the body, and specifically removes toxins and heavy metals. It does it very, very safely and very, very efficiently. And that's where we start. We start with Cell Defender, lowering our body burden, removing toxins. Now, how does that help? Well, the problem is, what do heavy metals do? What do toxins do in the body? For the most part, they inhibit natural metabolic processes. They use two examples. The first one is zinc finger proteins. So zinc finger proteins are called zinc finger proteins because it's a protein. It has a zinc atom in the very center of the protein that helps hold the shape of the molecule. Zinc finger proteins are necessary for cellular division. Anytime a cell is going to divide, zinc finger proteins come in and help copy that DNA so you can make a new cell. This is important when you have a cut, a scrape, a broken bone, but it's vital when you have an infection and you need to make more white blood cells. You need zinc finger proteins to copy those cells and make those cells. This is one of the reasons you might suck on a zinc lozenge or take a zinc supplement when you have a cold. More zinc finger proteins, more white blood cells, so you can fight the infection. Now, the problem is zinc can be displaced from zinc finger proteins by heavy metals, especially arsenic. So even if you have low-level arsenic poisoning, arsenic toxicity, that arsenic will displace the zinc, because arsenic is smaller than zinc. It changes the shape of the protein and it inactivates the protein. It no longer works. And so what happens when you have arsenic poisoning, even low-level arsenic poisoning? Well, you don't heal well. Cut scrapes don't heal well, your immune system shuts down, and it's all because of the zinc finger protein metabolism is downregulated. So one of the things we found with our zeolite is an upregulation of zinc finger protein metabolism. You heal faster, your immune system works better. And it's funny because people tell me, since I started taking your product, I noticed I had a scrape or a cut on my finger and it healed like overnight. Your product heals cuts. No, it doesn't. My product doesn't heal cuts. Your body heals cuts, which is amazing. Your body's supposed to do that. But when you have heavy metals, when you have toxins that inhibit natural metabolic processes, you get used to taking longer to heal, taking longer to get over a cold or a flu. And when your body's working the way it's supposed to, when you're clearing out that toxic competition, everything works better, everything works faster. Now, that's the underlying mechanism. That's the underlying common denominator is a cleaner, healthier body fixes itself. But there are lots of publications over the last 15 to 20 years since we started doing this work that looked at what zeolites are doing and what this zeolite, clinoptilolite, can do, not just in a healthy body, but even in disease states or use adjunctive to other therapies. And one of the publications that came out early on in 2004 looked at using clinoptilolite as adjunctive to chemotherapy and radiation, showing that in cancer patients, it improved patient outcomes and reduced side effects from chemotherapy and radiation. And one of the mechanisms they published was an upregulation of the P51 tumor suppressor gene. And this is interesting because we have genes in our body that are made to be watchdogs against cancer, because every one of us every day gets cancer. A cell mutates, and that's a cancer cell. But our body recognizes it and tells the cell to kill itself. That's apoptosis, programmed cell death, cell suicide. And we have tumor suppressor genes that activate, that tell the cell to kill itself because it's a damaged cell. For cancer to be successful, the cancer has to turn off all those mechanisms, all those tumor suppressor genes. So P51 is saying, is there anything wrong? Is there anything wrong? And the cancer is saying, no, there's nothing wrong. You go back to sleep. There's nothing wrong. But for some reason, in the presence of the zeolite, the P51 gene gets turned on and it starts that apoptotic process. Now, why? We have all sorts of theories. One of the theories is that the zeolite, for the most part, does not get into healthy cells. It really can't. It's too big. But cancer cells are voracious. Cancer cells, because they're constantly making copies of themselves, they need raw materials. They need things for growth. It's just like if you're a builder, you need wood, you need bricks, you need mortar, you need electrical cables, you need copper pipes, you need all this stuff to build more buildings. So cancer needs all this stuff to build more cancer cells. So anything that gets near a cancer cell gets sucked into the cell through endocytosis. It pulls it in. So imagine that you have this zeolite that's floating around your body and it's sucking up toxins, it's holding on to heavy metals, it's holding on to volatile organic compounds, and they get sucked into this cancer cell. So what happens? Now you have basically this toxic bomb that gets in the middle of the cell, and the tumor suppressor gene goes, whoa, what's going on now? And it activates that tumor suppressor gene. So that's the theory, and that's published now in 3 different papers, that they believe this is what's happening. So our particular zeolite is on the list for certain cancer centers, including the Cancer Treatment Centers of America in Tulsa has our zeolite listed for adjunctive therapy, adjunctive to chemo and radiation. So it's something that's certainly safe to use. It's certainly safe to help clean out the body, but there are other proposed mechanisms where, when used with allopathic therapy, could really improve patient outcomes.
Please contact the person who shared this with you for more information.
All right. Thank you. Awesome. Awesome. I was going to say everything he just said, just the same way he said. I think no one says it better than Rick Deitch, and so glad. Guys, I am going to end the majority of information. One thing I want to share with you. This is a red thread. And in Chinese culture, this is symbolic for being wrapped around the ankle of every human on the planet. Okay. And this isn't an ankle, obviously, but it connects all of us in the red thread theory, that all of us are connected this way. And how can we not be? How can we not care about our fellow man and woman, child, family members, friends, strangers, people we haven't met yet, right? So I just thought it was important to bring this out and remind you that we have, and remind all of us that we have a mission, a heart to get this information out. And I'm just again grateful because we have Avini Health. There's so many more products to share due to our restriction of time. We're not going to go over all of that. We have plenty of calls every Monday through Friday with information from really great people such as Dave Johnson himself, Valerie, Chip Littlejohn, our medical advisor, Paul Stowers, Diamond Leader, and Priscilla Proscenio, who gives from her heart every Thursday, and of course, Diamond Chris Bruce on Friday. I'm honored to do it on Mondays to share testimonials, as does Robin West on Tuesdays in the middle of the day at 3 p.m. Via Zoom like this one. And Marcy Littlejohn and her teams and her loving family on Wednesday nights to train us all. So there's so much here. There's so much here. And we're just going to go ahead and say, have a fabulous, fabulous weekend. Go be courageous, share someone, because remember, Cell Defender doesn't know any different. It's just going to do its job, whether we think it does or not, whether we believe it does or not. It's just going to clean house. So go out and make a fabulous day. Oh, yes. Do we have questions? Yes.
You have some, well, Rebecca says, thanks for inviting me. She appreciated it at the point that
Aw.
she said it. Does anybody else
Rebecca?
have questions? Because there's nothing up there yet.
Yeah. Rebecca, you are so, so welcome, hon. And everyone, just sharing, we've got some new people and we want them to understand that this is real. And it looks like we've got a couple of questions, maybe. Oh, all right. Rebecca says, yeah, I would love to, Rebecca, just really briefly. Everyone, I've known Rebecca probably now, I don't know, 6 years, 6 or 7 years. And at that time, when she was introduced to me through a mutual friend who knew her suffering, she's been suffering probably, I don't, since she was born. She's had struggles, and at some point, I will let her tell her story because I saw her on TikTok and sharing her heart that she was suffering. And I thought, oh my gosh, has no one reached her yet with Avini? Has no one gotten to her? And I think we had crossed paths in the past, a year prior, and she had declined at that time. But you know what? Heaven is faithful because for some reason this time she took a listen. And I'm really, really grateful that she did because I think we have an answer that has not been found for her and others. There are others like her in the world that are suffering and they don't know. They don't know. Just like I didn't know 2 years prior. And there are many, many people here who've known for years, for 20 years, 20 plus years. And you are a godsend. And if you have an obligation to tell people, and that's where my heart is, and like you. So, any other comments or questions? Ah, yes. Okay. Oh, thank you. I don't know who that is. Oh, Tony G. Thank you. You kill it too, darling. You do. You're amazing. Tony G is amazing. All right. Rebecca shares that she was born with a birth defect and she did have a kidney removed. Lifelong pain, chronic brain fog, needs to lose 93 pounds and her body is too sick to release the weight. And she is excited to give this a shot. She says, I'm honored and we will hear from you, Rebecca. We will. You can't escape our testimonials.
Okay.
Oh, yes. Thank you for asking that, Tara Kelly. What was the specific line for that video in our ever moving live? It's a living document right now. Currently, it is line 144. Isn't that a great video? Isn't that an awesome video of Robin West and Rick? I know. Isn't that fabulous? All right. And our question is, Oh, and it's a comment again from Rebecca. If she feels a difference, she will scream it from the rooftops. Okay, get your earplugs ready, darling. You are
John,
so
the Zoom information and the weekly morning calls are all at the top of Avini.com.
So John, we're gonna type that in for you, my friend. Avini Health Training.com document, and everything is there. Rich, Cotter, and friends have just agonizing, but they do it with love, organized incredible amounts of data that I actually find it interesting to try and pour through. That's how I found that video, is I just went looking. I wanted it to come from Rick, and it just had a bonus of Robin West being in there too. So do some digging. All right.
Boom.
Yes.
I think that was supposed to be said with more enthusiasm than I said it, but
You're welcome, John. All right. Anything else before we close out? We've got a great, great day. I'm going to be calling lots of people about this promotion, because this is a powerful, powerful promotion. Take advantage, those of you who have teams that you're looking for your Avini business to go to the next level. You don't want to waste these opportunities that Neil and Doug and Rick give us like this. All right. And Nikki Walton, you are amazing. Yes, you are. She saved my bacon again.